to make sure.
We are starting this week's episode with catching up on our checkup, and today we're talking with a dermatologist. Rebecca Dennison is joining me this morning. Good morning.
Good morning.
Thanks for coming in.
Yeah, thanks for having me.
So we are heading into Labor Day weekend, kind of the unofficial end of summer, although we know we can still feel the summer heat well into October. But we've spent the summers at the pool and at the lakes and at the beach, and our skin.
Yes.
When is an appropriate time to go ahead and schedule that appointment and get in and see a dermatologist?
Yes. So really what I say is any time of year is the perfect time of year to get a skin check. But a lot of people do wait until fall, winter. Okay. 80% of our sun exposure is in the spring and summer months. So, a lot of people have a natural tan throughout the summer. And so they'll wait till fall or winter to come in for their skin checks. But really, I tell people any time of year is fine. But a lot of people do wait until, fall.
So if you've never been to a dermatologist, because you guys are really scary, what do you say to someone? How do they prepare? How do you put them at ease? It's nothing to be anxious about.
Yes. They're really pretty quick visits, honestly. So anybody who's been in for their first time, we kind of go over your family history. Does your mom or dad have a history of skin cancer? Do you have a history of skin cancer or pre-cancer? We talk about tanning bed exposure. Do you wear sunscreen? And then we do a full body skin exam on you. So we get you in a gown typically, and we look at you head to toe. We're checking, all the places that you don't normally see on yourself. So your scalp, your back, that kind of thing. But we look, in between the toes, we look everywhere. But they're quick visits. And if we see anything abnormal, a lot of times we'll do that biopsy within the visit. It's a pretty quick procedure to do that. And then, we'll send that tissue to our pathologist and they'll check it. And hopefully it's all fine, but it's always good to, take that preventative step and get checked.
Absolutely. You were mentioning skin check.
Yes.
And so go ahead and define that.
Yes. So a skin check is just a thorough examination, and that's kind of what we typically call it. A full body exam is another name for it. But it's just where we're, checking anything that you may be worried about. So I have a lot of people who come in and they've noticed maybe a mole has changed or they have a new growth of some sorts, and they just want to have it looked at. And so a lot of times we're doing that. And then some people just come in and they have no worries and they just, want us to look at them and make sure they're okay.
What's the difference between a mole and a freckle from being out in the sun?
Yes. So freckles are usually caused from sun exposure. Okay. And a lot of times it's cumulative sun throughout your life. You start to get freckles. Mm-hmm. Even some sunburns can cause freckles. Okay. And then moles, usually you're going to make moles throughout your life into your 20s and 30s. And those are oftentimes the ones we worry about potentially changing into something precancerous or cancerous.
Okay. What are the different types of skin cancer? Because we hear different names and they all sound scary, and some may not be as terrifying as others.
Right. So melanoma is by far the most deadly and aggressive form of skin cancer, the one we really, really worry about. But there's also other skin cancers. So basal cell and squamous cell carcinomas are the kind of other two main ones. Okay. And those are usually caused from sunburns, cumulative sun exposure throughout your life. Okay. But the key with all that is a lot of times they're going to start off as a precancerous lesion. And so the goal is to catch those early before they turn into a skin cancer.
Gotcha. What is the treatment? I guess the preventative treatment would be the removal.
Yes.
Either way, it's removal.
Right.
But if it gets to an advanced stage, what are we looking at?
Yeah, so with melanoma, usually it's an excision. So further tissue is taken around the actual mole, and then all of that is checked again by pathology. with basal cell and squamous cell cancers, a lot of times we'll do a procedure called a Mohs procedure. Okay. And it's a micrographic procedure. It's done in office, so it's not anything you have to be put to sleep for or anything like that. Okay. It's just local anesthetic. But the Mohs surgeons check your tissue under the microscope before they close you back up, so they know that they've gotten the whole skin cancer.
Gotcha.
So.
Okay. And the best way to avoid it all the way around?
Yeah, so sunscreen is by far the best thing you can do, but then also just, preventing sunburns. That's a big thing. Really, if you've had 2 to 5 sunburns early on in life, that dramatically increases your risk for skin cancer. So, wide brim hat, sunscreens, nowadays we have sun protective clothing that's really helpful. So all that.
And how often should we be scheduling a dermatology visit?
Yeah, so really in your 20s and 30s is a great time to do an initial check. And then we may say, come back in, 2 or 3 years. But as you get older, really a yearly, annual skin check is what you want to do.
Okay. Anything else, Rebecca, that we need to know about it?
Well, I think the big thing is skin is the largest organ on our body, and the beauty behind these skin checks is that if a skin cancer is caught early, it's very treatable, and a lot of times a very non-invasive procedure to treat it. So the earlier the better, and that's kind of the main point. You really want to, a lot of people go in for their annual kind of, physical exams with their primary care doctor, maybe their annual dental exams. And so you really want to treat your skin the same way.
Okay. That is great advice. Well, thank you so much for coming in today.
Yes, thank you.
We are joined now by Angie Walker. She is the wife of Dr. Randy Walker in DeQueen, where he has a family practice. And Angie, thanks so much for joining us on AFMC TV. This is exciting. You are actually our first interview virtually, so we're excited. And isn't it fitting that we're talking about healthcare technology and we're using it?
Yes.
I'm curious, share with us some of the struggles, first of all, with healthcare technology that you guys have experienced, because it hasn't always been rainbows and gumdrops.
No, living in a rural area, our access to the internet is extremely limited. There are days that we have great internet. There's days that 3 o'clock comes, the kids get home from school and it doesn't move. There's days that it rains and it doesn't work. And so that one is a big one for us as far as technology goes, because we're electronic medical records. We've never had a paper chart. And so that's one of our biggest issues.
You guys have used technology before, though, pre-pandemic. Technology has been a big focus of the practice there.
We're big. I mean, if our IT people say we need it, we're doing it, because we know that this is where healthcare is moving. This is, especially in a rural area, we don't have access to the specialties, to the testing, to the different things. And we know for us to be able to have access to that and give access to our patients, we're going to have to pull technology in. I mean, that has to be a weighted factor. There's no other way to do it.
How long have you guys been on kind of the forefront here of technology?
I would love to say forever. I mean, it's kind of been our, when Dr. Walker opened practice in 2003, it was never a question about a paper chart. It was no, we're electronic medical records. We were one of the first practices to do the meaningful use, moving through all stages of it. We do a lot of demo stuff for eClinical Works when they're looking at different modules and what have you. We're always going to be the first one to raise our hand and say, yes, we want to do it, because we know that we're helping to shape what's going to happen. If you can't really complain about it if you didn't jump up and participate in molding it into what it needs to be.
Yeah. Talk a little about how your patients have embraced the healthcare technology, or not.
Well, and I'll tell you, so, pre-COVID, you had that demographic that liked that, that 30 to 40-year-old, they're working, they're busy, they just want to do a telehealth visit and move forward. Now we're on the backside of that. We're actually trying to do policy and, what is our clinic what's it going to look like for our clinic and managing those patients going forward? What things are we going to be able to deal with via telehealth? And what are those things that we're like, no, that's really an office visit.
And my last question, I'm also curious, what type of notifications does your office send out as it relates to maybe it's time for a checkup, or maybe it's time for those immunizations? You know, we're August now, school's starting in a matter of days, and for some in a matter of hours, it probably feels like. And so some of those last minute checkups, are you guys able to send those reminders via text message?
Absolutely. So within our system, we have what's called campaigns, and we set those up. A lot of times we set them up annually, but there are times when we're looking and creating depending on what's going on. And so we set those up on the back end, and it'll identify those patients that fall within that demographic, whether it's time for a physical, it's time for a wellness visit, or you missed a vaccine, and automatically sends those out for us.
It's amazing how technology is now playing such a big role in our lives. Angie, thank you so much.
Sure.
I appreciate your time. Joining us today is Mr. Randy Zuck. He is the president and CEO of the Arkansas State Chamber and Associated Industries. And first of all, Randy, thanks for joining us.
Thanks for having me. Nice to be with you.
We are partners on a very unique partnership,
Yes.
if you will, called Together Arkansas. And so I'm going to let you go ahead and explain just what is Together Arkansas.
Well, it's a little background. First of all, it's sort of been overshadowed by the pandemic and COVID and everything. But we several years ago realized that there was a terrible, just epidemic of opioid abuse and overdoses and resulting deaths and loss of time and all those bad things that go with it. But didn't know what to do about it. But along came Blue Cross Blue Shield. Curtis Barnett, who's on our executive committee, head of Blue Cross Blue Shield, said, why don't we try to do something? And then I think he contacted Ray Hanley, and first thing you know, we had this idea cooked up. And we take little credit for the idea, but a lot of credit for helping push it out across the state. Because we've pushed it into every community chamber of commerce. They in turn have pushed it into nearly every, I can't imagine a business that is not aware of this effort to inform people about the dangers of opioid abuse and help people realize what a rampaging issue it is across the state. I mean, we've just got literally thousands of families that have been disrupted, if not destroyed, as a result of abuse of opioids.
And there are resources.
Yes, there are resources available on our website, first point, togetherarkansas.com, which help employers understand step by step what to do, how to deal with people, proper places to go for additional help, how to connect employees and their family members with the resources necessary to combat this thing.
Talk a little bit about what you guys heard from the employers as it relates to when they realize they have an employee that is battling or dealing with maybe with an opioid problem or potential problem, or the fear that an employee may have a problem, and what have employers said to the chamber? Help us. What do we do? Guide us here.
Finally, and thanks.
Okay.
The resources are very valuable and very helpful. Employers are reluctant to intrude into employees' families. So that people, you think, well, we may have a problem, he or she may have a problem, but I don't want to meddle. I don't want to get in, it's none of my business. So
Right.
You kind of look the other way in some cases, probably for too long. But this helps you understand, first of all, the signals and the signs to look for, and then how to go about having a conversation. Trained HR people know how to deal with this sort of thing in many cases not. But most companies don't have a professional HR person on their staff.
That's right.
Most people in Arkansas work for companies where, you know, HR is a function that's handled by somebody who's wearing 3 or 4 other hats. So it's kind of catch as catch can. This gives those people the kind of tools they need to deal constructively and effectively with the problem with their employee.
Such a valuable resource, as
No question. It's just,
as we've said.
you know, because the costs of all of this are just horrific.
Yeah. Well, let me switch gears on you just for a moment and just talk overall about how is the state chamber doing? How are Chamber of Commerce's doing within the state? Everyone's taken a hit to some degree during the pandemic.
Really good question. The short answer is we're alive and well. We're in good shape financially in our case. Most chambers have figured out how to pivot during the pandemic, and we're all on Zoom. You know, we live on Zoom now. So that's been a big aid and a big resource for all of us. But the need for the activities of chambers are more important than ever in this kind of situation. A lot of it is sharing information, just pushing the information to them. We ran a little series called Recharge Arkansas to kind of, you know, just bring people together, because it became awfully easy to do since presenters didn't have to leave their offices, nor did the people who were watching. So that was a big resource and a big help for us. But in general, Chamber, we just completed our AEDCE, the Arkansas Economic Developers and Chamber Executives Conference, first time in 2 years, I guess. And just had a great meeting in Jonesboro, and it was exciting to get everybody back together and to hear how people had and are dealing with the challenges. But everybody's, you know, making our way.
Good.
Most people are back in the office.
Good.
So, you know, things are looking up.
Starting to have a few more signs of normalcy.
Yeah, and we're all working on getting people vaccinated now.
Sure.
So that's a big effort.
Okay. Fantastic. Well, listen, I know you are exceptionally busy, and so I appreciate your time for coming in and talking about Together Arkansas, and then just letting us know how well the state of the chamber is, if you will, across the state.
Great.
So thank you so much for coming
Appreciate
in.
it. You bet.